before you call me. Hey. Ooh, I'll take you around this party.
Senior year has been awesome. I'm captain of my baseball team. And then there's Diana. She's cute, totally chill, and doesn't stress me when I have baseball practice and can't hang out. When I'm not on the field, I'm hanging with her. We like to get out and explore our neighborhood in Queens when we've got the time. Like last weekend, she took me to this park that I'd never been to that had a bunch of art. Diana's really into that stuff, and I like doing it with her. We hit up our usual diner after the park and just sat around talking about the most random topics. There aren't a lot of girls like this one. I never have to put up a front when I'm with her, and she's the same way. I guess that's why she's the only one I've been with for like 3 months now. I never called anyone else my girl before. All the others were just hookups. We're really careful when we have sex. Neither of us is ready for a kid. I want to be a big college baseball player, and I don't want to do anything to mess that up. We won. It was a close game, and for a while there, I didn't think it was going to happen for us. Diana had to miss the game because of a doctor's appointment. I was about to call her with the news when her name lit up my phone. She was crying and yelling like she wanted to kill me. She said that she just left the clinic. When she was there last week for her birth control shot, the health educator told her it would be a good idea to get tested for STIs since we were having sex, even though we're exclusive. She agreed and left a urine sample. Now that the results were in, Diana went back to the clinic for them. She tested positive for chlamydia. She said she regretted trusting me, and then she started screaming at me about how I must have passed this thing to her after cheating. She barely let me talk. Nothing's wrong with me. I'm not sick. Nothing hurts. Nothing burns. I'm fine. I couldn't have given her anything because I don't have anything. Then it hit me. She's the one cheating. So I said, maybe she got it from one of her ex-boyfriends. After arguing for what seemed like forever, she said that the health educator gave her a prescription for me to get treated. They do that so she doesn't get reinfected by me. She's scared because the health educator told her that if chlamydia goes untreated, it can make it really hard for a girl to have a kid someday. I told her I would go get tested at the school health center tomorrow. Then she can take that prescription to the loser who really needs it. The next day, I went to the health center at school to meet with the health educator. I just had to fill out a form and was able to talk to someone right away. She was really friendly and totally straight with me. Even though Diana and I both say that we're only with each other, we still need to practice what she called dual protection. While Diana uses the shot, I definitely need to wear a condom every time we have sex, because birth control won't protect either of us against STIs like chlamydia. I asked her how this all could have started. I know that I didn't cheat on her, so doesn't that mean that she must have cheated on me to catch this? The health educator asked if I had been sexually active with anyone else before Diana. I told her yeah, a few here and there, but not since we hooked up. I know Diana wasn't a virgin either when we got serious. She asked if I'd ever been tested for STIs. I said no, but there's no reason. I feel fine and I only ever messed around with girls who are clean. The health educator told me that there's no way of really knowing who got chlamydia first, because neither one of us got tested before. It's got nothing to do with being dirty or clean, because many people with an STI don't show any symptoms. Without a test, you may never know you have it. Anyone who gets with someone and doesn't use protection, even once, is at risk for HIV, STIs, or pregnancy. She said I should stop worrying about who had what and face the basics. It's important to trust each other, but it's just as important to get tested regularly and use birth control and condoms every time. She also gave me a whole bunch of condoms. I decided to get tested right there, but I still wasn't too worried.
It is what it is.
I went back to the clinic for my results a few days later. The doctor told me that my test did come back positive for chlamydia. She gave me medication to take care of it, right then and there. She mixed it into a glass of water, and I drank it on the spot. She also showed me the Teens in NYC app. It helps find nearby clinics where I can go after I graduate for testing and condoms. Plus, the app has a lot of information about safe sex and birth control. I downloaded it on my phone for free and found a clinic that isn't far from my house. Diane and I decided to stay together. It was hard to trust each other again, but we're doing a lot better now that we have all the information. We promised each other to use protection every time we have sex and to get tested regularly. We're never going to be exactly sure how this whole thing started, but we can definitely be sure of how it ends. Hi, my name is Ryan. I played Chris in the video you just saw. Trust is important between partners, but it's just as important to take precautions. Get tested for HIV and STIs before having sex with a new partner. Many people who have an STI feel fine and don't know they have one. Get treated for chlamydia if you do test positive. An untreated STI can cause serious health problems. Use dual protection, birth control and condoms every time you have sex to prevent pregnancy, HIV, and STIs. Diana is using the shot as her form of birth control. The depot shot is given by a provider every 3 months. It works really well to prevent pregnancy when used consistently, and it's safe for most young women to use. If you're a teenager in New York City, there are places you can go for free, confidential sexual health services. It's easy to find somewhere to go, and you don't need permission from anyone to get services.